Good morning everyone. So today I am going to continue the topic cholera. Yesterday we have seen regarding agent factors, host factors, environmental factors and mode of transmission. Mainly today I am going to discuss regarding the control of cholera. So these were the guidelines which was given by the WHO mainly to control the cholera. First one is verification and diagnosis. Second one is notification. Third one is early case finding. And fourth one is establishment of treatment centers, rehydration therapy, adjuvant therapy, epidemiological investigation, sanitation measures, chemoprophylaxis, vaccination and health education. So all these are the topics that we are going to discuss today. What is this verification and diagnosis? If we want to control the cholera in a proper way, first we need to verify and we need to diagnose the disease. So it is important to confirm the outbreak of cholera. Next one is all cases of diarrhea should be investigated even on slightest suspicion. What you have to do? We have to identify the outbreak of cholera. How we can identify? If you find any diarrhea case with slightest suspicion, you have to go for the investigation of this Vibrio cholerae. For specific diagnosis of cholera, it is important to identify Vibrio cholerae 01 in stools of the patient. So if you want to diagnose the patient specifically that he is having a cholera, you should go for the identification of Vibrio cholerae in the stools of the patient. Next one is once the presence is proved. If you came to identify that the stools of the patient is having this Vibrio cholerae 01, you have to go for the treatment and you need not to go for any kind of cultures or stools because you have already founded this organism in the stools of the patient. Next one is bacteriological diagnosis of cholera envisages a well organized system of laboratory services in the community. What you have to do? You have to go for bacteriological diagnosis of cholera. Notification. So cholera, it is a notifiable disease, either it is locally or nationally, but it is not notifiable internationally. All the health workers should have an awareness to identify the disease, and if they find out any cholera case, they have to immediately inform the health authority. Mainly under the international health regulations, cholera is notifiable to the WHO within 24 hours. So if you find any patient with cholera, if you diagnose any patient with cholera, you have to inform WHO. You have to inform WHO within 24 hours of the occurrence by the national government. The number of cases and the number of deaths has to be reported daily and weekly till the area is declared free from the cholera. So if you take current situation, this COVID-19, what the government of India is doing, it is identifying the number of cases. They are doing specifically diagnosis. If they find out any suspicious person, if any person is going there with cough, fever and any flu-like symptoms, what they are doing the test for corona, COVID-19. If they find out, if they suspect also, they are sending them into the quarantine. In the same way, what you have to do, if you find out any patient with this cholera, if you find out any suspicion case, you have to inform to the local authority. And this suspicion, if you confirm the case is having this cholera, you have to inform to the WHO within the 24 hours of the identification of disease. And once you have started informing this WHO, you have to inform WHO all the daily reports, like how many new cases has been identified and how many cases has been hospitalized and how many deaths had been occurred. What is the incidence rate of the disease per 1 day and per 1 week and per 1 month, and the area is declared free once the incidence rate is getting down and there is no cases more than double than the incubation period of the disease. You can see the point here. An area is declared free from cholera when twice the incubation period, that is 10 days, has elapsed since the death and recovery or isolation of the last case. This is notification. The third one is early case finding. What is this early case finding? It is an aggressive search for case. So now also you can see people People are coming from home to home and they are doing the investigation, mainly COVID-19 investigation. Why they are doing? They want to prevent this, they want to break the chain of the disease. In the same way, if it is mild, moderate, severe, it should be made within the community with able to initiate prompt treatment. So aggressive case, search for the case. We have to go and search for any infected case and we have to treat the case. Early detection of cases also permit the detection of infected household contacts and helps the epidemiologist in investigating the means of spread for deciding on specific intervention. What this statement is saying, once we are able to find out the case, once we are able to detect the case as early as possible, you can treat the case and you can treat the contacts as well as. So once you are identifying the contacts, once you are able to start the treatment, then easily you can stop the spread and you can go for the specific treatment based on the organism which had infected them. Next one is establishment of treatment. In control of cholera, no time should be lost for providing treatment to patients. Why no time should be lost in providing treatment to patient? Means cholera, it is a severe disease where the person can go for death also, because the fluid had been losing from the body in a short period. It is abrupt and within short period the person may enter into the death state. So in order to prevent those things, we have to treat the case as early as possible. And it is a communicable disease which can be spread from one person to another person. If this contaminated articles is going to the community, it can infect entire community. So in order to prevent all those things, you should treat the cholera. Hence treatment centers must be established to community as close as possible. So you have to establish the treatment centers as close as possible. The next one is the mildly dehydrated patients. So you can see these mildly dehydrated patients which are accounting about 90% of the case, and these should be treated at home with oral rehydration fluid. And severely dehydrated patients requiring intravenous fluid, these patients should be transferred to the hospitals. If possible, they should receive oral rehydration on the way to hospital center. Why? Because the more the amount of fluid is lost, the higher the chance of mortality. Rehydration therapy. So cholera is now the most effectively treated disease because mortality rate has been brought down to less than 1% by effective rehydration therapy. That rehydration, it could be oral or it could be intravenous. Coming to the oral rehydration, so it was given by the WHO in the year 1971. It was given by the WHO in the year 1971. It has greatly simplified the treatment of cholera and other acute diarrheal diseases. Mainly the aim of this oral rehydration, is to prevent the dehydration as well as to reduce the mortality. They want to prevent the dehydration and reduce the mortality. Once the dehydration is prevented, automatically the mortality rate can be also decreased. Next one is, it has been the experience of workers at Kolkata that as many as 90 to 95% of all cases of cholera and acute diarrheal disease can be treated with oral fluid alone. So what was experienced in Kolkata? They have treated nearly 90 to 95% of the cases with oral fluid alone. The next one is, oral fluid therapy is based on the observation that glucose is given orally and enhances the intestinal absorption of salt, water, and it is capable of correcting the electrolyte and water deficit. So what the statement is saying, if you are able to provide oral fluid therapy, then the body itself will enhances intestinal absorption and it takes off required amount of salt, required amount of water, and it is capable of correcting the electrolyte imbalance on its own. And the composition of oral rehydration fluid is recommended by WHO is like this. So this is the composition of reduced osmolarity. So ORS, this is the composition of ORS. You can screenshot this. Sodium chloride, glucose, anhydrous, potassium chloride, and trisodium citrate, dihydrate are the solutions which were used. And the others are like in grams. If you take, these are this is the amount, and if in ml if you take, this is the amount. You can screenshot this and you can keep it in your notes. So how you can assess that the person is dehydrated? So these are the guidelines which were provided by the WHO, mainly in the assessments of dehydration. So you have to check for the patient's appearance, you have to check for pulse, you have to check for blood pressure, skin elasticity, you have to check the tongue, anterior fontanelle and urine flow. So you can consider the patient is having mild dehydration when the patient is thirsty, alert and restless. And if you check the radial pulse, it will be normal and volume, and if you check the blood pressure, it will be normal. If you check the skin elasticity, it will retract immediately, tongue will be little moist and anterior fontanelle will be look normal, and urine flow is also normal, and weight loss will be just for 4 to 5%, and estimated fluid deficit will be 40 to 50 ml per kg body weight. If the patient is having these symptoms, when the patient appears drowsy, limp, cold and sweaty, it may be comatose. You can see the patient is going for severe dehydration. If you check the pulse will be rapid, sometimes feeble and sometimes impalpable also. It could be it will be in a tachycardia state, means you can the pulse rate will be increasing and it will be feeble. You may find out, you may not find out the pulse, and the blood pressure also is less than 80 mm of Hg, and sometimes it may be unrecordable and if you pinch the skin elasticity will be reduced and tongue looks very dry, and eyes will be, anterior fontanelle will be sunken, and urine flow will be little less, or you may not find out the urine flow, and body weight loss will be more than 10% body weight loss you can observe, and estimated fluid deficit will be 10 to 100 ml per kg body weight. You can screenshot this and you can take it down in your notes. So these are the guidelines for dehydration therapy for all ages. So this one also you can see here, based on the weight. If under 4, the ORS solution is like 200 to 400 ml for the children who are less than 4 months, and if they are having the weight under 5. If the age of the child is 4 to 11 months and the weight is about 5 kgs to 7.9 kgs, then you have to go for 400 to 600 ml. If the age of the baby is 1 to 2 years and weight is about 8 to 10, you have to go for 600 to 800 ml. And you can see it in the chart here. If the age is above 15 years, you have to go for, and the weight is more than 30, you have to go for 2.2 liters to 4 liters per kg body weight. Intravenous rehydration. What is this intravenous rehydration? If the patient is not responding for oral rehydration therapy, then you have to go for this intravenous rehydration. Intravenous infusion is usually required only for the initial rehydration of severely dehydrated patients who are in shock or unable to drink. So if the patient is going into shock, means in severely dehydrated patient, and if they are unable to drink, the oral rehydration, then you have to go for intravenous rehydration. So initially we will give them intravenous rehydration. Once the patient is out of the shock and he is able to drink, we will go for oral rehydration therapy. So these patients should be transmitted to nearest hospital or any treatment center, and the solutions recommended for WHO for intravenous solutions are Ringer lactate solutions. It is also called as Hartmann solution for injection, and diarrhea treatment solution. It is also known as DTS. If nothing is available, you can go for simple normal saline. So these are the recommended dose of IV fluid to be given in 100 ml per kg body divided as follows. Discuss regarding this maintenance therapy. So when they will do this maintenance therapy means once they came to know that the dehydration have been gone, the signs of this dehydration have been gone, then they will initiate this maintenance therapy. What they will do based on the diarrhea. If it is mild diarrhea, means the person is not going for stools for more than 2 hours or longer than, and if the amount of diarrhea which is going is less than 5 ml per kg body weight, then they will administer 100 ml per kg body weight until the diarrhea stop. How much fluid they will administer? They will administer 100 ml per kg body weight per day until the diarrhea is getting stopped. If it is severe, that means more than 1 stool per every 2 hours and more than 5 ml of stool per kg per 1 hour, then they will give like they will replace the stool losses volume for volume. If not measurable, they will give 10 to 5 ml per kg body weight per 1 hour. This is the maintenance therapy. Coming to the adjacents to therapy. So antibiotics are given as soon as the vomiting stops. The common antibiotics which were used as fluoroquinolones, tetracyclines, azithromycin, ampicillin, and trimethoprim, sulfamethoxazole. So these are some antibiotics. So erythromycin and chloramphenicol, they are used when none of the recommended antibiotics are available, and they only when Vibrio cholerae 01 is resistant to the latter. The next one is sanitation measures. Mainly we have to go for the water control, excreta disposal, food sanitation and disinfection. Once you follow these sanitation measures, you can control the transmission of the disease cholera. So chemoprophylaxis means mainly mass chemoprophylaxis is not advised for the entire community. Chemoprophylaxis is mainly meant for the household context, means the persons who had been exposed to the person, and tetracycline is the drug of choice for the chemoprophylaxis. It is given over 3-day period twice daily, that is of 500 mg for adults and 125 mg for the children who are aging from 4 to 13 years old, and 50 mg for the children who are 0 to 3 years of old. This is the chemoprophylaxis for the disease cholera. So if prevailing strains are resistant to the tetracycline, then you can go for the doxycycline 300 mg for adults and 6 mg per kg body weight in children who are under 15 years old. Vaccine. Coming to the vaccine, there are mainly two types of vaccine: killed oral 01 with whole cell with B subunit, and killed oral 01 and 0139. So the number of doses will be like 2 doses, that is minimum 1 week and maximum 6 weeks apart, and 3 doses for children aged 2 to 5 years, minimum 1 week and maximum 6 weeks apart, and 2 doses for 14 doses apart for the individuals who are aged greater than 2 years, and the booster dose is recommended after 2 years of age. Contraindications are hypersensitivity to previous dose, and adverse reactions include mild gastrointestinal distributions. How to prevent means mainly through water and sanitation and hygiene, social mobilization and awareness. We have to treat the cases as early as possible, and you have to keep surveillance. Health education, it is the most and effective prophylactic measure. The benefit of early reporting and proper hygiene measures should taught to the community, and it should be directed mainly to effectiveness and simplicity of oral rehydration therapy, and benefits of early reporting and prompt treatment, and food hygiene practices, hand washing after defecation and before eating, and benefit of cooked and hot food are safe water. And since the cholera is mainly disease of poor and ignorant, these groups should be tackled first. Coming to the health education. So health education is the most effective and prophylactic measure, and we have to educate the patient for early benefit of reporting the cases and proper hygiene if they maintain. All these things should be taught to the community, and mainly the health education is directed to what is the effectiveness and the simplicity of this oral rehydration therapy, and what are the benefits if you report early reporting of the disease and prompt treatment, and what are the food hygiene practices they have to follow, what is the importance of hand washing after the defecation and before eating, and what is the benefit of cooked and hot and safe water, and all these things we have to say to the people. Because cholera is a disease mainly which is occurring in a poor sanitation and poor and ignorant people. So if you are able to follow all the above listed things, if you are able to follow all these things, then you can prevent the transmission of this cholera. So this is regarding cholera. If you have any doubts, you can contact me through my email and through my WhatsApp. Thank you. Thanks for watching.